So the following presentation is an evolutionary, it describes the evolution of the body contouring of the torso from the early abdominoplasties through into the thigh buttock lifts, and how that then evolved into rib removals, and how we've improved the procedures with time so that we get a better, more natural result for a happier patient. And we were able to incorporate one technique into another, and how these things sort of all come together to where we finally are right now, at the state of the current state of the art.
So we're going to talk a bit about the body contouring and how that relates to abdominoplasty, thigh buttock lift, and rib removals, and the natural progression from one into the other over time, how things have changed, and the evolution of the process. The first tummy tucks or abdominoplasties were performed back in the 1800s to remove the excess skin at the time of umbilical hernia repairs, because people were starting to get lots of abdominal surgery as anesthesia improved, blood banking and so forth started to come into the foray. And so you had these people who had these complications after a major abdominal surgery. And there were a number of different patterns that were used over time from the late 1800s, early 1900s in through 1955. You can see there's been a lot of playing with the pattern to try and get the best result. The early problems that they noted were that if you only took out the skin, you didn't get enough tightening. You couldn't get an hourglass shape in a woman if you didn't address the issue of lax muscles after being pregnant in the past. The early scars widened and they were unsightly in the visible areas, and that came about more in the last 10 plus years with Lockwood especially, describing a triple layer closure of the incision that helped get a better quality scar. And then you had some patients that needed skin removal on the sides and the back because they just had so much skin. You couldn't just stop the incision in the front, because then you end up with this dog ear or pleat at the edges on the sides. And the old patterns didn't do anything for the thighs as well. This just shows you some of the anatomy involved in the area. And I'll use this pointer here. So you see here, these are the abdominal muscles, the muscles that give you the six-pack, and then there's the rib cage here. Your chest muscles are up there. And the muscles that contribute to that six-pack look is called the rectus. And if you open up the covering on top of the rectus, you can see that the muscle is divided, and that's what contributes to giving the six-pack look. And when plastic surgeons as a group discovered that they needed to tighten the muscle, they found out that these two muscles were separated in the midline, especially if the patient had had childbirth in the distant past, because the baby in the womb stretched everything out. So then the process involved stitching the inner edges of the muscle together along the midline, from the rib cage all the way down to the pubic area, above and below the belly button. This is a pattern that came about in the early 70s and the late 60s. Pitangui used this one in Rio de Janeiro, and then Regnault up in Montreal used this W. The problems were that this one here shows up in the French cut type bikini, and it's crossing boundaries. It's not, there's a natural boundary of the hip which is actually obliquely directed in this fashion, and this crosses the boundary, so it actually ends up being a more unsightly scar. The other problem was they just made in both cases, they just made an incision, then pulled the upper skin down and cut off the excess, and that didn't deal with the outer edges, so you were always taking out more skin in the middle part than you were on the outer edges of either one of those patterns. And then liposuction was added in the 80s, and that dramatically improved the results. Lockwood in the 90s came up with this pattern, so it's sort of the W and a U at the same time, and that ended up being the best one because you can see how that follows the natural boundary line between the hip and the torso. If you look at a baby doll that has movable joints, the line is placed in the same fashion. And that also allowed the removal of more skin at the edges instead of just taking out skin in the midline. And then also in the process of increasing the amount of skin, opening up this angle here, you're pulling the thigh skin up and you end up with some thigh tightening. In addition to that, this is Lockwood's work, he brought to everybody's attention that there really are two layers of fat underneath the skin. There's this layer of fat that's just underneath the skin, and then there's a deeper layer that sits right on top of the muscle, and there's a membrane between those two layers of fat that gives the fat some substance. Otherwise, it can't hold anything. It has no structure to it. You can put your finger right through a piece of fat, and this gives it some durability. This is a patient of mine who underwent an abdominoplasty, and in her case she had no excess fat. It's just an issue of excess skin and separation of the muscles in the abdomen. And you can see that here. She's got a lot of excess skin. It's all wrinkled around the belly button. She has separation of these two muscles. There's one here on her left and this one on her right, and there's a valley in between them. And this is the outer edge of the muscle there and the outer edge there. So in the process of doing the procedure, the two edges are sutured together, so the valley disappears in between the two muscles. And in the process, the outer edge is brought in to give her a more hourglass shape. And this pattern of skin incision is the W on top with the U underneath. And you can see how that follows the anatomical division between the leg and the torso, number one. And number two, allows you to get some thigh tightening. So if you look at this thigh, it looks like it's a younger person than that thigh, because the skin has a different quality to it after you've removed it. And you can see part of that here. There's a little bulge here of excess skin, and that is removed when you open that angle up and pull that up. This is another patient with very lax muscle, so that you can see it in a front to back plane, how the muscle, when it's separated and very loose, allows the abdominal contents, the intestines and everything, to protrude forward. And if you just did a skin procedure here, you wouldn't get this kind of flatness of the abdominal wall that she wants. Also, you can see here the thighs have a different quality to them, aside from the photo being slightly different. So the advantages of this other pattern with the W on top and the U on the bottom, which we call a high lateral tension, because you're taking out additional skin laterally or at the outer edges, is that it addresses the excess on the sides as well as the midline, as I've already alluded to. It can easily be extended for these lateral thigh and buttock lifts that we now do. It tightens the thighs. You can get access to tighten the muscle, which virtually every plastic surgeon does now. You can easily hide that in an undergarment, like I've shown you in that previous picture. And the incision lines fall in the natural boundaries between the legs and the torso. And also in the process, we do this triple layer closure that gives you a better result and scar quality. Now, this process has been extended over time to, in some cases, treat cellulite or a lot of excess skin after weight loss, massive weight loss. And the procedures are basically the same, whether it's massive weight loss or cellulite, that you need to tighten the thigh and the buttock area to address that. I've had mixed results with this. I don't usually do it for cellulite anymore because it's such a big operation, and I don't think you get enough improvement to warrant that, although some people have published pictures that looks like they've gotten enough to warrant the procedure. My experience, it doesn't do enough, and so I do it mostly, the thigh buttock lifts, mostly for just excess skin after massive weight loss.
So yet a treatment for cellulite?
Yes. So cellulite is basically, to describe it first, it's the only word we have to describe this uneven pitted surface or dimpling of the skin that you see on the thighs of women. There are three severities of it, where the skin has to be pinched in order to see the dimpling, or it's dimpling visible only when standing, or it's visible despite or irrespective of what position the patient's body is in.